Amanda, go ahead.
Oh, yeah, thank you. Just as a follow-up from our conversation yesterday, now the Providence Police have had partnerships with Family Service, Providence Center, the Nonviolence Institute, and other community partners. And it's noted in the report, but it appears the report is asking for more. Did PFM find that those partnerships were effective, and what does the police department need to do differently?
Sure, I can take this, and then Ron, if you want to chime in, that would be great. So it's a really good question, Amanda. The PFM report does not include an evaluation of those processes. We weren't engaged to perform an effectiveness or a program evaluation of those services. Certainly, we've seen those services around the country, and Ron's led departments with that type of a background and experience. But my understanding, and city folks can correct me if I'm inaccurate, is that as part of the process of understanding potential alternatives in the design that's included in the current city year budget, that process of understanding what's working and what's best meets the city's needs on a go-forward basis is happening through that vehicle.
And another answer to your question, Amanda, is that throughout the nation since the 1960s, governments have slowly transitioned to designating the police as the first responder to substance abuse, mental health, and chronic homelessness. It's accelerated in the last 10 to 5 years. This has reverted a system that was meant to provide mental health care and substance abuse care into the criminal justice system. So the Providence Police Department, which has been an acknowledged leader in the partnership program of community policing, just needs to continue finding ways through a whole of government approach under the mayor's leadership to create another entity than the police department to be the designated first responder to these questions. There will always be times when you may need fire, you may need police, but it's a question of the government, the whole of government being the designated first responder, not the police. And this is a movement that's coming across the nation. Providence has a chance to take a leadership role in that, as they did in community policing 20 years ago.
Thanks for that.
Jump in real quick and just note that community policing is actually something that we're not asking for as a community, because that actually places us in more danger. It is not helpful to have more police who look like us to give us ice cream and then only to violate our constitutional rights out in the streets when we're mourning our community members. So as much as Providence is a leader in community policing, that doesn't mean anything to us, because that's not something that we're asking for. Instead, what we're asking for is a complete defunding of the Providence Police Department so that we can shape safety in ways that doesn't include a violent system.
Steph, I'll head over to you next.
Hey there. Question for the mayor. As you know, following up on our discussion yesterday, it does seem like this report is going to be cited and discussed as the city looks into diversionary services and changes in policy in the police department. So I want to ask, again, are you going to disclose the identity of the private donor who paid for the report? And if not, how can you justify keeping that a secret?
Yeah. So we have a donor who asked to remain private, who funded the bulk of this report. What I can assure is that the funder had absolutely no say in terms of the work that was done, the research that was done, the scope of the work, or the results of the work. And so we've worked with PFM in the past, and they're a reputable firm known for their integrity and their work at doing these kinds of analyses. And about 5 or 6 years ago, they sketched for us a 10-year plan around our finances and our infrastructure. And that's effectively been our roadmap that has allowed us to turn around our finances and now be in a position where we're in the strongest fiscal position that we've been in a very long time. I'd say decades. And so I give that example to say that they've produced reports for us in the past that have been the foundation for the work that we had done. And I trust their integrity in the work product that they've put together. And that's what we're going to base the work going forward on.
It seems like you're going to have some difficult conversations with the union, for example, about making some of these changes. I'm wondering if you think this is going to be an issue. Will they even see value in a report when they don't know who paid for it, where it came from?
Again, I mean, we will cross that bridge when we come to it. What I can absolutely say is that PFM is a reputable firm, and they're known for their integrity. They've done work throughout the country, including for us in the past. And if folks have any questions about the reliability of the data and the analysis that they've put together, we'll answer all of those questions and and cross those bridges when we come to it. But I feel comfortable and given the work that we've done in the past, the work product that they put together here, and the reputation throughout the country doing this kind of work, that this information can and should form the basis for decisions that we make around public safety going forward.
Could I also ask you, Mayor, to address the violence that we have seen in the past couple of days in Providence? We had a homicide and then another shooting. Any words that you have on that, and also if the commissioner and the chief have anything to add about that?
Wait, do you guys mind if I just do one more? Lynzi has a question on PFM, and then we'll go to this after. Sorry, just 1 second, Mayor. Lynzi, she couldn't use the raise your hand feature, sorry.
Thank you so much, Teresa.
Yeah.
Mayor, Commissioner Perry, if either of you, would like to answer this, just to help people visualize a little bit what this means for a response from the police department, for a response from the fire department. Will the police department be working with mental health counselors or responders in a way like that? What will this result look like in change?
That's a good question, Lynzi, and this is ongoing work. So, for example, as I mentioned earlier, we're also in the process of designing a community safety preventive model, where you have a whole of government approach to public safety. And so that's being worked on as we speak. And over the coming months, we brought in, or we're in the process of bringing in, an organization that's going to help design that entire model. As they design that model, they certainly have this report to draw on. And there's the basis of this report that PFM put together, along with other work that we're doing internally and in the community. So what exact shape it takes, that's to be determined. But again, this is an opportunity for us to be leaders in public safety and to think about what public safety of the future looks like, and to start making those investments right now. So I hope that answers your question. I do want to give a specific example that sort of stands out in my mind. As we look at how we're allocating resources, we do have to ask ourselves, are we investing our resources in the most efficient and the most appropriate way? So, for example, right now, anytime that there's a fender bender accident where there's minimal damage to cars and no one is injured, we send a police officer to fill out a police report. This is effectively a public service that we provide for the private insurance companies. Is this the best use of a fully trained police officer? That's the kind of questions that we should be asking. And this report gives us some data, some figures to actually make decisions on. And we want to look up and down all of public safety to make sure that we're actually investing in the needs of the community. I mentioned at the very beginning that the calls that we're receiving coming in for mental health incidents that our residents are having, they've doubled over the past couple of years. And we weren't providing the level of services to meet the need 2 years ago, much less today. So again, this is going to allow us to make the decisions so that we can be proactive in addressing crime in a preventive way and adopting a whole of government approach to it. I'll pass it over to the commissioner if you have anything to add to that.
Yeah, thanks, Mayor. Look, it's been more than 10 years, probably 15, that we've had clinicians ride in police cars. There's nothing worse than going to a call, mental health, behavioral health call as a police officer, and not having, the either proper training or understanding of what that person may be suffering. So Providence, long ago, partnered with social workers, and they ride with us. And we wish they could ride more often. And I think this is the beginning of a program like we've seen across the country, so that the professional clinicians and mental health workers can go and provide the service and get the help that's needed on those calls, rather than send a police officer in the middle of that, because it's complicated. And so we're looking at those programs as we build this, so we don't even have to go to those calls, and they can be dealt with by the professionals that know how to deal with people that suffer so many mental health issues and behavioral health issues. That's just one example. As I said earlier, this isn't a 3-month fix and we're done with this. This is a roadmap for public safety for the next 5 to 10 years that we can use and change the way we do business. People want the police to come in a lot of areas, but we don't have enough resources to respond to those calls, and we need the community's understanding, community's involvement and decision about what they want their public safety team to respond to and not to respond to.
Quickly, just Commissioner, I know you see the results of this as a process right now, but do you see then the loss of any number of officers, or is it more of a restructuring? Do you see officers taking on different roles? Is that something that's being visualized?
I mean, we're responding to over 130,000 calls a year. I mean, if you do the math, these officers are responding quite frequently to non-violent and non-police related calls. But nobody has stopped and said, should we be responding to those calls? And if we didn't, who can, first of all? And then we always struggle in this profession to keep our officers well trained. And so I don't envision a reduction in FTEs or police officers. I envision a reallocation, so we are properly prepared to respond to the violent calls and police related calls, and other entities in government can respond to those non-police calls that I predict have been overwhelming across the country, and was certainly here in the city of Providence.
Thank you both.
All right, and then I'm gonna come back to Steph's question. Sorry, Steph, do you want to repeat it quickly?
Oh yeah, another one of my colleagues is covering the homicide and the shooting that happened in the city this week, and I was wondering if the mayor had any thoughts.
Sure, thank you, Steph. Just another terrible incident where a young life is taken, and it's been such a difficult year for so many different reasons, including the fact that there's been a rise in violent crimes throughout the city. Anytime this happens, it's a concern, and it's something that we take extremely seriously. But with what we're seeing here in Providence, and combined with what we're seeing throughout the country, it's of a particular concern. There are heavy societal factors at play in all of this, and we have to get down to the bottom of it. What we want to do is we want to create a system that allows everyone to be a part of the solution, allows everyone to not just lend their voice, but lend their hands, and to either provide opportunities for young people so that they're not turning to crime, to also work with de-escalating situations, be it by police officers or within the community itself, and making sure that our families and our kids see hope through some other means, and they're not turning to violence and not turning to violence to resolve their disputes. So just a terrible situation or incident over the past couple of days, and we'll be working as a city to not only bring the perpetrators to justice, but also give new options and opportunities for kids and young people so that they're not turning to a life of violence.
And really quick, since these two shootings did happen near each other, Commissioner, do you, or Chief, if you're on the call, or any indication that these shootings are connected?
Yeah, so, you know, we're looking into that. This was a targeted both homicide and shooting last night. So we're providing as many resources. Let me say, look, you know, gun violence and shootings are horrific. And they're relatively young, 21-year-old victim taken from his family, leaving a family, and now a shooting last evening. It's probably tied one to the other, but we haven't yet, you know, completed and pulled all of the evidence together to see what the motive is. But these are targeted shootings, and it's sad that people find themselves in a predicament where they resort to violence. The Institute's been involved with us on this shooting in the last couple of days, and it's been a strong partner and has had a great effect on some of these kids that have access to guns and use it violently. But obviously, we're not catching them all, and we're going to hold them responsible as a result of the shootings, and we hope to prevent it with strategies and resources that are in place so we can get them out of that cycle of violence.